My name is Manoj. I'm the periodontist here at Elmsleigh House. Periodontics is about the treatment of gum disease. Gum disease is essentially the structures that surround the tooth itself and keep the tooth within the bone. So people can get essentially two types of diseases in the mouth. One is decay that affects the tooth itself, and one is the supporting structures. So I specialize in the supporting structures of the tooth. If left untreated, you can essentially lose your tooth, and you don't realize until slightly later on in the process when the tooth becomes a bit loose. Eating becomes a bit more difficult, and then you start going to the dentist and you say, I've got a problem. So the first time a patient will see me, we'll carry out a full assessment, and that includes assessment of how good their cleaning is, and then to understand the extent and severity of the disease itself. So the simplest treatment is non-surgical treatment, whereby we'll numb up the teeth and the gums, and we'll do some deep cleaning on the root surfaces. That's where all the bacteria and plaque are. There are some cases whereby, especially more severe cases, whereby you might need some further treatment. Sometimes this is more surgical in nature, very delicate surgery, where you might be able to regenerate some of the lost tissues, or we just need better access to make it easier for you to be able to clean later on when all the treatment is complete. So the things that might make you want to come and see a periodontist is the simple signs of gum disease. Do your gums bleed when they brush? Have you got some sensitivity? Are your teeth mobile? Have you got bad breath? Those are quite simple things to try and notice yourself when you're at home, when you're brushing your teeth. Other reasons apart from general gum disease to come and see a periodontist might be for gum recession, where your roots are exposed. We can do some gum grafting surgery to cover that up again. There might be areas where you've got too much gum showing, and we can do crown lengthening to actually make the appearance of the teeth much nicer in the smile. Some patients will have dental implants, and unfortunately, some patients can be susceptible to gum disease around implants. So our hygienist will always check that there's no deterioration in your gum health. And if they're concerned about that, they might speak to your dentist, or they might come and speak directly to me, and we can have a look then. So coming to Elmsleigh House is quite a unique experience. What you feel straight away is it's quite a nice, welcoming environment. It doesn't feel like a clinic. You'll also get the friendliness from our welcome team, and you'll realize how well the dental clinicians will work with the nursing staff, and your patient journey will be fantastic from the moment you enter to the moment you then leave at the end of your appointment.